This animation is adapted from The Cliff Analogy of Health by Dr. Kamara Jones. Imagine students falling off of the cliff with unmet physical, mental, social, and emotional health needs. School-based health centers are right below the edge of the cliff at the secondary prevention level, catching most of these youth as they fall over. As vital safety net providers, they are in the best position to observe and understand which social factors and life stressors affect their students. They pair with schools and the community to remove these barriers so students can focus on learning. The SBHC net serves to minimize the effects of injury and illness. Such examples include issuing STI screenings and other early detection programs. Among those caught by the net, there will be some students who will persist in a trampoline-like state, continuously bouncing up and down with less than optimal health and unable to get back to the top of the cliff. Imagine this trampoline-like state as revolving doors for students who are continuously present with unmanaged symptoms every time they come back and forth to the clinic. In other cases, students might even slip through the cracks in the safety net and require emergency medical or rehabilitation services to minimize disability, death, or incarceration. This is defined as tertiary prevention. So, our initial response might be to place a barricade at the top of the cliff to prevent students from falling off in the first place. This represents primary prevention, which includes immunizations and health education. But realistically, this might not hold up from the challenges facing the entire student population. In order to move further upstream and push students back away from the edge of the cliff, we have to begin by addressing the social determinants of health. Different factors exist beyond our genes and individual behaviors. These factors are beyond what students' parents are capable of controlling. They include racism and discrimination, violence, dilapidated buildings, unstable housing, a lack of running water or electricity, and many more that cause chronic stress. The APHA program to improve graduation codifies the upstream response that push youth back away from the edge of the cliff. The program offers a 3-level strategy to support schools in integrating public health prevention school-wide for transformational changes. Level 1. Clinical intervention. Examples of approaches include school-wide health screenings, healing circles, and mental health counseling with groups inside and outside of the clinic. Level 2. Primary prevention. Examples of approaches include offering washers, dryers, showers, and meditation or a de-escalation room, which are made available to the school-wide population. Level 3. Systems interventions. Examples of approaches include peer juries and restorative models of school discipline, training and employment opportunities for students and families, and curriculum or schedule adjustments based on the student's needs. At this level, key stakeholders review, revise, and/or create policies and practices in the clinic, school, school district, community, or beyond. With each of these levels acting in unison, health and education stakeholders are more likely to ensure that no student ever falls off the cliff.